So once again, good evening. So today's topic is Sthanika Chikitsa in Streeroga. I thank the organizers for giving me this opportunity. So when we see the line of management of the any Streeroga conditions, whether it is Yoni Vyapat or Artava Vyapat or any other Streeroga condition, and few of the conditions in Prasuti Tantra, we see that the Sthanika Chikitsas have been given the importance. So today we will just discuss the basics of Sthanika Chikitsa in Streeroga. So these are the contents. That is the roots of drug administration, Sthanika Chikitsa in PTSR, advantages of vaginal route, defense mechanism of reproductive attack, preparation of the patient for the Sthanika Chikitsa procedure, and brief view of the Sthanika Chikitsa. Now, coming to the routes of drug administration. There are different routes of drug administration. First one is the oral route. Next is the parenteral route, wherein all the medications are given either intravenously, intramuscularly, or subcutaneously. Next is the topical route, applied to the skin for a local or body-wide effect. Fourth one is the inhalation route. That is, the medications are sprayed into the nose and absorbed through the nasal membrane and breathed into the lungs, usually through the mouth or by the nose. That is, by inhalation or by nebulization. Next comes the mucosal route, wherein the medication is kept in the mucous membrane. So, in this, the medication can be kept below the tongue, which is called as sublingual route of administration, and between the gums and cheeks, which is the buccal cavity route of administration, placed in the eye or the ear, inserted into the rectum, and inserted into the vagina. So each route has specific purpose, advantages, and disadvantages. Next, coming to the Streeroga and the Prasuti Tantra, in this we can classify the Chikitsa into Shamana Aushadas or the Shodhana Chikitsa and the well-pronounced Sthanika Chikitsa. The different Sthanika Chikitsas which we can see in the Prasuti and the Streeroga are the Yoni Pichu, Yoni Dhavana, Yoni Varti, Yoni Purana, Yoni Lepana, Yoni Dhupana, Charakarma, Agni Karma, and the Uttarabasti. So here, Uttarabasti, usually we consider it as under the Sthanika Chikitsa, but Uttarabasti is a type of Basti Chikitsa, which is clearly told by Vagbata. Because the route of administration is the Yoni, probably with that the classification is usually told under the Sthanika Chikitsa, but clearly the Uttarabasti is a type of Basti Chikitsa. Now, coming to the advantages of the vaginal drug administration. The vagina, the main function of vagina is a passage for the birth. It acts as a birth canal, a passage for menstrual blood, and repository for sperms during copulation. In medical field, the vagina is a well-known route of drug administration due to the following reasons. Relatively large area and rich blood supply in the vagina contribute to high permeability to several drugs, allowing higher bioavailability of some active substances when compared to other routes. It both provides the systemic as well as the local effects. Next is because of the relative large surface area and rich blood supply, this organ has high permeability to several drugs, allowing higher bioavailability of some active substances when compared to the other routes. Provides both systemic and local effects. Substances absorbed through the vaginal mucosa bypass the liver before entering the systemic circulation. So, avoiding the hepatic first pass metabolism. So, because of this, the some of the complications which arise because of the oral administration, like the gastrointestinal disturbances, can be controlled, and also the drug will have a very effective action. Next is the vagina presents less sensitivity, because when we see the nervous innervation of the vagina, especially the upper part of the vagina, we can see that it is mainly having the autonomic nervous supply, and sensory nervous supply is very comparatively very less. So because of this, the patient will not feel the pain or any irritation when the medication is introduced into the vaginal cavity. So because of this, the drug formulations can be kept in the vagina for a longer period of time. So, for example, when we see the administration of the pichu, usually we say that the pichu should be kept for a mutra kala. So, before the procedure starts, we ask the patient to evacuate the bladder, and then we introduce the pichu, and it will be removed after say about 2 to 3 hours, or when the patient has the sensation of micturition. So this is because the vagina is comparatively less sensitive. Next is the benefits are, it is easy self insertion and removal of the drug, requiring no intervention by the medical personnel. So it can be very private also. So this is usually applicable to the drugs like the pessaries or the contraceptive drugs which are there, which are the small tablets which can be usually inserted by the patient or the lady, and it can be removed, or some of the drugs they get absorbed, but it cannot be so for the Sthanika Chikitsas which are told in our classics. Next benefit is, it is the process is very easy, it is painless, and it is reversible. So when we say reversible, suppose if there is, after the administration of the pichu or the douche, etc., suppose if the lady gets any complications, these complications can be easily handled. Next advantage is, it is having minimal interference with the body functions or other medications, and also it will not affect the daily life of the lady. As already I told, the gastrointestinal side effects are much less when the medication is introduced through the vaginal route. So, next, coming to the defense mechanism of the reproductive tract. So, the vagina, actually, the genital tract and the urinary tract, and on the other hand, the anus, they are in very close proximity to each other, where the from the anus also there is high contamination, and on the other side from the urinary tract also there is high contamination. But still we see that this contamination will not be transported to the reproductive tract. That is because of the special defense mechanism which is prevailing in the reproductive tract. So when we see the reproductive tract, the organs starting from the vulva till the uterus, we see that there is a very good defense mechanism. So let us briefly see these defense mechanism of the reproductive tract. The first one is the vulval defense. So anatomically, we can see that there is a position of the cleft by the labia, and also there are the Bartholin's gland, which prevent the ascent of the infection into the reproductive tract. Physiologically, when we see the fungicidal action of the secretions of the apocrine glands, and also the natural high resistance to infection of the vulval and the perineal skin. Next is the vaginal defense. During the reproductive period, wherein there is high estrogen content, the vaginal defense is fully restored. This is because during the in the reproductive period there is the presence of the bacilli, which is called as the Deoderlin's bacilli, and because of this the vaginal pH is maintained somewhere between 4 to 4.5. But sometimes there is chance that this pH will be increased because of the infections, or because of the menstruation, or because of the unhygienic conditions, etc. Then there will be growth of the other organisms, and it will lead to the infection. Otherwise, if the pH is in the range of 4 to 4.5, there is less chance of infection. Next, coming to the cervical defense, once again anatomically there is the presence of the glands, racemose type of glands, and also there is a mucus plug. So this mucus plug, the characteristic of the mucus plug may change in accordance with the menstruation. The the plug is usually thick in the second half of the menstruation, whereas in the first half the mucus will be watery. Next is the physiological defense is because of the bactericidal effect of the mucus. Next, coming to the uterine defense, the cyclic shedding of the endometrium. So during the periods, the functional layer of the endometrium will be shed off. Along with this endometrium, if there is any microorganisms which are present or which have entered into the uterus, they also will be shed off. Hence, the chance of the infection is minimized. Next, coming to the closure of the uterine ostium of the fallopian tube with the slightest inflammatory reaction in the endometrium. Next is the tubal defense. So anatomically, we can see that the integrated mucus plicae and the epithelial cilia are present, and physiologically peristalsis of the tube and also the movement of the cilia towards the uterus. So because of this, the movement of the cilia towards the uterus, if there is any microorganisms which are present in the tube, they may be pushed into the uterus. From there, they will be expelled out through the vagina during the menstruation, wherein the functional layer of the endometrium is shed off. So, this is the defense mechanism of the reproductive system, which will be more pronounced during the reproductive period. This defense mechanism may be affected after the menopause or before the puberty, because as we see, the pH of the reproductive tract is becoming alkaline because there is no presence of the duodenales bacilli, which maintain the pH in between 4 to 4.5. So next we'll see what are the causes wherein there is loss of defense when in the different phases of life. So following 10 days of the birth till puberty is reached, usually the defense is very less. So what will happen before the 10 days? That is from the birth till the 10 days. Here till 10 days, there will be the formation of the duodenales bacilli. That is because of the estrogen which is present in the mother, which will be supplied to the baby. Hence, the pH will be maintained and there will be defense in the genital tract. But once after the 10th day of the birth, the estrogen level comes down, hence the defense also is lost. Next is during the reproductive period, wherein we can see usually during the menstruation and also after the abortion and after the childbirth, the pH increases, it becomes alkaline, and after the menopause also the pH increases. It is no longer acidic, but it becomes alkaline, and the defense of the genital tract or the reproductive tract will be comparatively less. So next is, suppose if there is infection, the type of organisms which will be present in the reproductive tract, the common causative organisms which are seen in the genital tract. The bacterial pathogens involved in the upper genital tract infection are principally derived from the normal flora of the vagina and the endocervix. Usually what happens is the pathogens will be present in the vagina as well as the endocervix. But just because the pH is acidic, these will not be very active and the chance of infection will be less. But when the defense mechanism of the reproductive tract is lost, these organisms which are present in the normal flora of the vagina, they become activated and they may lead to the infection. So the organisms which we can see are, the first one is the pyogenic organisms, which are the gram-positive organisms like the staphylococcus, and the gram-negative organisms like the E. coli, Pseudomonas, gonorrhea, etc. And also anaerobes. The gram-positive are the anaerobic streptococcus or the Clostridium welchi, and the gram-negative are mainly bacterioid groups, which are Bacteroides fragilis is the most common one. Next, coming to the group of the organisms are the organisms which are responsible for the STDs. They are like the chlamydia, trachomotis or the treponema, palladium, and the herpes simplex virus type 2, human papilloma virus, and the Gardnerella vaginalis, etc. And also HIV-1 or the HIV-2, etc. So among this, usually the organisms like the human papilloma virus, they are most common cause of the cervical cancer in the female. Next group of the organisms which we can see are the parasitic organisms like the Trichomonas vaginalis. And the fourth group is the fungal. The most common is the Candida albicans, which can be seen in a woman who is suffering from the diabetes mellitus. And the fifth group is the viral. In this, the most common one is the herpes simplex virus type 2, human papilloma virus, HIV 1 and 2, etc. Next, coming to the tubercular. So, the organism which we find is the Mycobacterium tuberculosis. So, what is the mode of spread of these infections? Once the organisms are present in the reproductive tract, might be they are present in the vagina or they have gained access into the uterus through the cervix, then how the infection will spread. So the route of infection is most commonly ascending in nature. That is, it starts from the vulva, it gets access into the vagina, then it enters into the uterus. So apart from this, the other ways from where the infection can spread is it is through the continuity and contiguity. That is through the main infection, that is the gonococcal infection will spread in this manner. Next is through lymphatics and the pelvic veins. So here usually this will be seen in the post-abortal infections and the purpureal infections. The organisms will take access through the lymphatics or the pelvic veins. Next is through the bloodstream tubercular. Usually the lady may be having the pulmonary tuberculosis, and the microorganism, it will enter into the bloodstream and it may gain access into the reproductive tract and it may give rise to the genital tuberculosis. Next is from the adjacent infected extragenital organs like the intestines and also the other pelvic infections. Suppose the patient is suffering from the appendicitis. Then, if it is not treated, it may spread into the reproductive tract. If the lady has any urinary tract infection, then it may gain access into the reproductive tract. So, these are the types of the spread of the infections. Now, this is regarding the reproductive tract in spread of infections of the reproductive tract and also the defense mechanism which tries to control the infections. Now, coming to the subject proper, that is the Sthanika Chikitsa. So, when we have to advise Sthanika Chikitsa to the patient, first of all, the first line of treatment has to be followed. That is the Shamana has to be followed. And if by the Shamana, if the patient is not getting any relief, then we may go for the Sthanika Chikitsas. Even though in the Prasuti and the Streeroga, especially in the Streeroga, as we know, the treatments are Shamana, Shodhana, and the Sthanika Chikitsa. Here, we have to assess the patient and we have to just see whether the patient needs all the three chikitsas, that is the Shamana, Shodhana, and the Sthanika chikitsas, or the patient needs only the Shamana and the Sthanika chikitsa. So for this we have to evaluate the patient properly. So first of all, we have to take the history, proper history taking, which usually is the, we have to take the general history, then also we have to take her marital history. So as we take the, as we have in the pro forma, we have to take a very good history. So the history of the previous deliveries, previous abortions, and her menstruation, the pattern of the menstruation, whether it is regular or whether it is irregular or she is having very heavy flow, all these also has to be taken. Once the history is taken, then the examination, general examination, systemic examination, and the local examination of the patient has to be done. And after the examination, we have to go for the required investigations and exclusion criteria, if any. So this is for the Sthanika Chikitsa. So we suppose the lady, for example, the lady has come with the history of the Shweta Pradara. We have done the local examination and we see that the patient is having the vaginitis and we plan for the yoni dhavana. But if the patient is giving us the history of the diabetes mellitus or diabetes mellitus which is uncontrolled, or if she is a cardiac patient with the already she has undergone the interventions, or if she is having the IUCD in situ, in all these conditions, we have to see if the patient is fit for the dhavana purpose. Okay, that is because if the patient is suffering from the cardiac pathologies, then usually what happens is we have to see that no infection from the outside has to enter the body of that lady. Hence, she may not be a fit patient for the Sthanika Chikitsa. So here we have, that is why a very good history has to be taken before giving the, before planning for the Sthanika Chikitsa. Next is the diagnosis, and next after that comes the planning the Sthanika Chikitsa. So here, as I told, the per vaginal examination, why it is necessary. So when the patient says that, the example as we saw in the history of complaining of white discharge, the patient complains of white discharge. So directly we are not in a position to give the dhavana. As we know, dhavana is very good for the white discharge. But when we do the vaginal examination, okay, if the lady is having vaginitis, then dhavana chikitsa may be sufficient. But in case she has any cervical pathology, like she may be having a cervical erosion, then only dhavana is not sufficient. With the dhavana, she may need the treatment like the Ksarakarma because for the cervical erosion. So once the cervical erosion is treated by the Ksarakarma, then the dhavana can be given. So we may need two procedures there. One is the Charakarma and another one is the Yoni Dhavana. So before doing any Sthanika Chikitsa, the pervaginal examination is very much important. So here the prerequisites for the pervaginal examination is, first of all, we have to take the aseptic precautions. This can be done by cleaning the external genital organs with the antiseptic solution and seeing the pH of the vagina. So here we have got the strips, pH strips. These are the strips. So we have to introduce this strip into the vagina and wait for 1 minute, and there will be change in the color of this strip, as you see the change in the color of the strip here. Okay, and after that, this strip has to be compared with the standard chart which is given here. Okay, the color has to be compared. So here there are different colors depending upon the pH of the strip which is dipped or immersed into the vagina. Okay, so then we can decide the pH. So usually, as we have seen, if there is infection, there will be change in the pH. From the acidic state, it will be in the alkaline state. So here, after seeing the pH, then we go for the per speculum examination. So per speculum examination is usually done by using the speculum and the anterior vaginal wall retractor. So by doing this, we can see the condition of the vagina. If there is any inflammation in the vagina, or if there is discharge, white discharge, or if there is any blood stain discharge, etc., can be seen by the per speculum examination. And also, along with this, we can see the cervix, whether the cervix is healthy or it is unhealthy. Like sometimes what happens is the cervix may be hypertrophied and it may be irregular in shape and it may bleed on touch, and also there may be presence of erosion or there may be inflammation of the cervix. So all these can be seen by doing the per speculum examination. Once the per speculum examination is done, the speculum and the anterior vaginal wall retractor should be removed and the digital examination has to be done. So this paravaginal examination or the digital examination. So for this, we have to introduce two fingers, that is the index finger and the middle finger of the right hand into the vagina, and the another hand, left hand, should be kept on the abdomen. And we have to, as we enter into the vagina and reach the cervix, we have to just move the cervix. When we move the cervix, if the patient complains of pain, then we call it as cervical motion tenderness present, which is the sign of the infection of the upper genital tract, or it is a sign of PID. Then we have to see the position of the uterus, and also we have to see the size of the uterus. Sometimes the uterus may be bulky or it may be of the size less than the normal, or it may be normal size. Next, we have to go into the fornix. Just move the fingers from the beneath the uterus to the sides, right and the left side. There also we have to check for the pain. That is, when we just keep the fingers in any of the fornix and just press the hand which is kept on the abdomen if the patient complains of pain, or if there is any change in the facial expression of the patient, then it indicates that there is tenderness present. And also sometimes there is the chance of presence of the mass in the fornixes. So these are the two things which we have to see in the fornix. That is, one is the tenderness and if there is any mass. So this is briefly regarding the pervaginal examination which has to be done before going for the Sthanika Chikitsa. So, and depending upon the result which we get with the pervaginal examination, we have to just select the proper Sthanika Chikitsa which is needed. So, now we will briefly see each and every type of the Sthanika Chikitsa. First one is the Yoni Pichu. So, Pichu or a tampon, it is made up of cotton swab and usually the size is of 2 into 3 centimeters, or it is approximately 1 inch in size, and it is wrapped with the gauze piece and tied with the long thread. So this is the Pichu. In the classics also it is called as the Karpasasya Vastram. Karpasa Tula. So these are the references which are told in the classics for the tampon. So this pichu will be soaked in the medicament which is desired. So it can be a grata, or it can be a taila, or it can be a kashaya as per the need, and this will be placed in the vagina. So here the procedure, I am not going in very detail because we have to see the procedures, each and every procedure. So here the procedure is, first of all, we have to take the antiseptic precaution. Here also the pichu which we have prepared, and also the medicaments, like if it is a grata, those has to be autoclaved compulsorily. Then the patient should avoid the urine. So for all the Sthanika Chikitsas, we have to give the Sthanika Chikitsa after avoiding the urine, and the patient is made to sleep in the supine position, and genital area is cleaned with the antiseptic solution, and yoni prakshalana is given. So this is optional. Sometimes we may need the yoni prakshalana, as I gave the example previously. If the patient is having vaginitis and also the cervical erosion, then yoni prakshalana may be given. Or in some of the procedures in the classics also, they say that before starting the other treatments, one yoni prakshalana or the yoni dhavana has to be done. So if it is told, it has to be followed. Then pichu is dipped in the aushadha and it is inserted into the vagina. And the thread of the pichu should be left out of the vagina for easy removal. So here we have to take care that the portion of the thread which has to be kept outside the vagina, it once again it should not be very long. It sometimes it is just enough that you keep the thread at the orifice. Instead of keeping it outside, you just keep it in the outlet, just in the inlet of the vagina, so that when the patient puts her finger into the vagina, it can be felt easily and it can be removed. Otherwise, if a long portion is left outside, once again there are chances of contamination either from the anal route or from the urinary tract. Next, after the insertion, the patient should lie in the lithotomy position for 15 to 20 minutes. And this should be kept till the subsequent urge for micturition, as told in the classics, that is Amutra Kala. So some of the indications for the pichu. So it is clearly given in the classics or in the text which is told the what type of pichu has to be given in what type of the vyapats. For the yoni vyapats or for the garbhasrava, for the aparasanga, the particular pichu is told. So same pichu can be given. Or sometimes even if it is not classical preparation, we can make our own preparations also. So here we can see that. So this is one of the theses which is done. So this is the Vatadi Taila Yoni Pichu and the Vatadi Taila capsules which are given in the Shweta Pradhara. So this is a thesis which is going on in our institution right now. So what we have made is we have just made the modification. The Pichu, the medication which is taken here, that is we have taken the vata, lodra, etc. medicines, and thaila is prepared. So this thaila is taken for the pichu, and the same is made into the capsule form. So here you can see on the right side, that is the vatadi thaila soft gel capsules. So we are doing a comparative study. Here what we have done is we have done the Avartana, 7 avartanas are done so that the efficacy of the drug will be improved. And the studies also show that it has got a very good effect on the infections. So here, whether it is a vaginitis or it is the cervicitis, etc., we see that we have got very good effect. So here I would like to tell about one of the patient. She is about 53 years old and she was having vaginal infection. She has attained menopause, and sorry, she has not attained menopause, but she is having irregular menopause. She is in the perimenopausal period, and since 3 years she is suffering from the infections, recurrent infections, and she was taking treatment in one of the tertiary institutions which is nearby to Udupi, and they have given all sorts of medications, but she was not cured completely, and she has come to our institution and we have given this Vata Taila Yoni Pichu, and she is in our follow up. So she is completely relieved of her symptoms. So this is a benefit of the This is the benefit of the Vatadi Taila Yoni Pichu. Here we have to see that the Avartana is done. 7 Avartana is given. And same, we have given another group, we have given the soft gel capsules. Here also the effect is very good. So next example is the Lodradi Kalkapichu and the Ashwagandha Kshirapaka and the Changeryadi Grata orally in the Prastramsini Yoni Vyapa. So here also you can see the effect. You can see the effect. So the case 1, so this is before treatment, you can see the prolapse here. She was having the huge cystocele. After the treatment, you can see that it has decreased. Similarly, in the case 2 also, there was a prolapse here, which is comparatively decreased in the after the treatment. Even in the third, there was minimal prolapse, but after the treatment, it has decreased completely. So here, mode of action, which helps the medicine to remain in the site for a longer time, and there is better action. And also it can give the Shodhana and the Ropana action depending upon the drugs we have selected, and also it softens and strengthens the vaginal canal. Next is Pichu in the 9th month of the pregnancy, helps in elevation of the Vata, and it imparts snehana in the vaginal canal. So here also, whoever is practicing obstetrics, we can see that the pichu along with the matra basti, the pichu in the ninth month, and in the same period after the completion of preferably 38 weeks, if pichu is given and also matra basti with the any vatahara tailas is given, it helps in the easy delivery. So as it is told, it is helping in the snehana of the garbha marga. Next also, the indication is it is helping in the Garbhasrava and also Garbha Shosha. Next is the Veshavara. So here this is a modified form of the Pichu wherein the Ajamamsa, the cut Ajamamsa is kept in the Pichu and it is inserted into the vagina. So the benefit is it corrects the laxity of the pelvic tissues. Next is the Yoni Dhavana or the vaginal douche. So douche is a procedure, or the word douche means it is to wash or soak. So it is the procedure of intravaginal washing with the medicated solution. So the some of the synonyms are achamana, and also it is called as the yoni seka, yoni parisheka, yoni sechana, etc. So here the douche, which the instruments which are used for giving the douche. Once again, not going in detail. So here what the materials which are required are the douche can and the decoction. So the quantity of the decoction is about 500 ml to 1000 ml can be taken. So the once again the procedure is, first of all, the patient is kept in the lithotomy position and aseptic measures will be taken. The douche is taken in the douche can, and before starting the treatment, we have to clean the vulva with the aseptic solution, and after that, clean the vulva with the medicament which we have taken for giving the douche. And after that, inside the vagina, and the fluid should flow very slowly. The 1500 or 1000 ml of fluid the patient is asked to cough after the procedure to remove the excess of liquid from the vagina. Then the vulva is dried with the gauze. Next is the syringe method. So alternative method in this, what we do is we take a syringe of 50 ml capacity, fill the syringe with the medicament and push the liquid inside the vaginal cavity. Next, after the medicament 50 ml is filled, then it will drain out, and once again take the medicament and push it into the vaginal cavity. So we have to repeat this procedure for about 50 to 20 times until the complete kashaya which we have taken is over. We have to repeat the procedure. Once the kashaya is completely drained out, the patient is told to cough and the remaining kashaya comes out from the vagina. Suppose we have to give a pichu after the dhavana procedure, after the parisheka procedure, we see that all the kashaya which is present in the vaginal cavity has to be drained out completely. Only after that, the pichu has to be inserted into the vagina, especially if the pichu is having any oily preparations. Otherwise, what happens is the liquid which is present, which is of the liquid which is of the parisheka is present in that itself. If you introduce the pichu, then there is chance of the infection. So we have to take care before introducing the pichu. So indications already which are told in the classics. Next is the mode of action. So here the drugs are absorbed through the mucosa and the blood circulation of the vagina. So the Yonidhavana is favorable in causing the increase in the blood flow of the vaginal mucosa, resulting in the increased drug absorption. So the drugs used are usually having the antiseptic, antimicrobial action. Hence, they are helping in healing the infection and also decreasing the pain. Next is the yoni dhupana. So here it is the fumigation of the yoni with the aushadha yukta dhuma, and it is indicated usually in the Streeroga conditions and also in the prasava avastha, wherein if there is aparasanga etc., you have to give the yoni dhupana, and it will be a routine procedure in the sutika paricharya. The site of the dhupana is the bhaya yoni. So here nowadays there is a this procedure is modified. We have the chairs wherein the patient can comfortably sit on the chair, and beneath the chair the dhupana dravyas will be kept, and the dhupana of the bahya yoni will be done. So here, before the Purva karmas are the as usual the Purva karmas, routine Purva karmas for the Sthanika procedure. The patient has to evacuate the bladder, and patient has to lie down in the lithotomy position. And here we have to take care that the legs should be covered with the leggings. That is because the dhupa, it may, because if the legs are not covered with the leggings, the patient may feel the heat on the thighs, and it will be causing discomfort to the patient. So before the dhupana, the abhyanga of the yoni has to be done. Next, coming to the pradhana karma, with the gloved hand, vagina is exposed using the Sims speculum and the anterior vaginal wall retractor, and the coarse powder of the eva, which is mixed with the small pieces of gugulu and niryasa of the sarala and gograta is done, and this mixture is put on the red hot charcoal in a dhupana yantra, and once enough fumes come out, it is kept at a distance of approximately 15 to 20 centimeters or 10 to 12 inches from the vagina. So this is actually one of the research research protocol which was done as a PG study. So here what drug we have used was Gugulu and the Niryasa of the Sarala and the Gograta. And so here we can see the procedure here. So we have taken the patient in the lithotomy position, and the patient is covered here well with the leggings, and also there is a covering which is given for the anterior abdominal wall, and here we have exposed the cervix, and in the next the dhupana is given to the yoni. The cervix is exposed with the help of the speculum. So this is the procedure which we have followed instead of using the chair. This is because here when the chair is used, the dhupana is given only to the bahya yoni, but here the some amount of dhupa enters into the vagina also. So coming back to the procedure here, paschat karma, after the dhupana is over. So how long we have to give the dhupana is till the patient feels the heat. Initially, the patient will not feel the heat. So once the patient tells that she is feeling the heat, then we have to stop the procedure. So after the procedure, the patient is instructed not to wash the vagina at least for 2 hours or till the feeling of the micturition. And next is abstinence for at least 7 days, and later compulsory use of barrier method, especially the male condom, for a period of 1 month has to be done. So now coming to the mode of action, here dhupana is shrotosodaka, it is kafagna, kledagna and srava stambaka. So this is especially beneficial in the pelvic infections. Next, coming to the Varti Kalpana, we can call it as the vaginal suppositories. So Varti is considered as the modified form of the Vati Kalpana. So Vartis are made by processing the churna with the Guda, Sharkara, Gugulu, or by macerating with the Madhu, Gugulu, etc. So, and these are dried in shade and stored in airtight containers. Vartis, when kept in the Yoni Pradesha, they are called as the Yoni Vartis. So here also the procedure, the genital area is cleaned with the antiseptic solution. Yoni Prakshalana is done. Then vagina is lubricated, and the Varti also, it should be lubricated either with the Taila, Ghrata, Madhu or the Dugdha, and it is inserted into the yoni. So here vagina should be lubricated in certain conditions, like when the Varti is very Tikshna. If the Varti is very Tikshna, then the vagina also should be lubricated. And the Varti should be retained until the subsequent urge for the micturition. And after that, the Varti should be removed. So indications as told in the classics, mainly in the Kafaja Yoni Vyapat, Acharana Yoni Vyapat, and Yoni Paichilya, and also in the Anartava. So here the mode of action. So the mode of action usually depends upon the type of the Varti. So here the Vartis are usually Srava Hara, hence it can be used in the Kafaja Yoni Vapats or in the conditions like the Yoni Paichilya, etc. Next is the Charakarma. So this is a surgical procedure or it is usually classified under the Anu Shastras. Ksharana, Kshanadva Ksharaha. Ksharana is to displace the vitiated structures like the Tvak, Mamsa, etc. And Ksharana is to destroy or corrode the tissue. So here where we have to use in the Prasuti Streeroga is usually in the conditions wherein we have to destroy or corrode the tissues, and which is the condition wherein we have to destroy the tissue, that is usually in the conditions like the cervical erosion, wherein we can see that there is the growth of the epithelium, overgrowth of the epithelium, And because of this overgrowth, usually there are more chances of the cervical erosion getting infected, and the patient will complain of the regular white discharge. And if this is not treated, the infection may gain access into the uterus and it may lead to the PID. So here, just because there is the overgrowth of the tissue, the ideal procedure or the Sthanika Chikitsa which has to be selected is the Kshara Karma. So here the procedure of the Kshara Karma is, as usual, the aseptic precautions, and the patient should be put in the lithotomy position. Yoni Prakshalana is given and the cervix is exposed with the speculum, especially here the cuspo speculum, which is the self-retaining speculum, which can expose the cervix, only the cervix, and the vaginal walls will not be exposed, so that the kshara can be actually inserted or applied over the affected area on the cervix. So here the kshara has to be taken. It can be taken with the a cotton swab which is wrapped to the any of the instruments which are straight, like the straight artery forceps. It can be taken, the kshara can be taken, and it should be applied over the erosion or the affected area, and it should be kept there for about 100 matra kala. So one matra kala is one just closure of the eyelid, isn't it? Just closing and opening of the eyelid. So 100 matra kalas, or the area which becomes like the pakwa jambu phala. So till that time the kshara should be left on the affected area, and after that we have to just remove the instrument and clean the area with the Nimbu Swarasa. And after that, Yoni Pichu should be kept. So the Yoni Pichu can be kept with the Jatyadi Taila, which has got a healing effect. So this procedure, once again, it has to be repeated for about 7 days. So we can give a gap of 1 day and we can repeat the procedure. Depending upon the condition of the patient, we can repeat the procedure either by giving the gap, or it can be given continuously. So other forms of the ksharas which can be used are, it can be ksharodaka, ksharasutra, ksaravarti, ksharalepa, and the kshara jala. Mode of action is, it does the Chedana, Bhedana, Lekana. It has got both the Saumya and the Tikshna actions. It can be used in the conditions where surgery is difficult to perform. Next is the Yoni Purana. So, usually the Yoni Purana, or the filling of the Yoni with the either Taila, Kalka, Pinda, or the Churna. So these will be filled in the yoni and it will be kept there till the urge for the micturition, and after that it will be removed. Next, if needed, Sukambu Prakshalana will be done. So indications: Kafaja Yoni Vapat, Vataja Yoni Vapat, Mahayoni, Kunapagandhi, Artavadushti, Yoni, Ghadikarana, etc. So in these conditions, the Yoni Purana can be done, and depending upon the condition, the medication has to be used. So here, what is the action? If the Purana is done with the Sneha Yukta Dravyas, then it is having the Balya action. Thus, it helps in the strengthening the yoni. And if the formulations which are mentioned in the classics for the yoni ghadi karana, then what happens is it gives strength to the perineal muscles, and the prolapse, if there is minimum laxity of the vagina because of the multiparity, or because of the difficult labor, etc., there may be laxity of the vagina. In these conditions, the yoni purana has to be done with the dravyas which are helping the ghadikarana of the yoni. And also it has got, if the kashaya tikta dravyas are used, it helps in ropana, kledahara and the sravahara action. Next is the yoni lepana. So here medicines in the form of the kalka are applied in the yoni. The here, depending upon the condition, the kalka will be prepared and it will be applied uniformly inside the yoni. And how long it has to be kept? It should be removed immediately after drying. Next, coming to the mode of the action, once again, it is, if the lepa is vatahara, it will be beneficial in the yoni shula. And if the tikta kashaya rasapradana dravyas are used, it will be vrana shodaka and also vrana ropaka, and also it will be having the shofahara action. Next is the yoni abhyanga. So this is a procedure of applying the sneha dravyas in the yoni. So here the patient is made to lie in the lithotomy position. Gloved finger is dipped in the thaila and abhyanga is done in the yoni for 5 to 10 minutes. And patient is asked to lie down for 15 minutes. So here, what is the benefit? So here the yoni abhyanga has to be performed for strengthening the yoni. It gives strength to the vaginal muscles and also it tones up the vaginal muscles, and it is a routine procedure. Yoni abhyanga is a routine procedure, or it is a pre-operative procedure for the Uttara Basti. So these are some of the Sthanika Chikitsas which are routinely used in the clinical practice, especially in the Streeroga, and also some of the Sthanika Chikitsas can be used in the Prasuti Tantra also. Next, coming to the Uttarabasti, as already told, Uttarabasti, it is not a Sthanika Chikitsa, but it is a type of the Basti Chikitsa. But the mode of, or the route of administration is the genital tract. Uttarabasti, as we know the definition, the Uttarabasti is called so because the drugs are used. The administration of the drugs is through the Uttara Marga, and also it has the Sreshta Guna, and also it is called as Uttarabasti because it is administered after the Niruha Basti. Niruha Uttarena. That is why it is called as the Uttara Basti. And once next is, it is administered through the Uttara Marga of the routine Basti Marga. So the Basti Marga is the anal route. So Uttara too, or just in front, the reproductive tract is just in front of the anal route. Hence, this is also called, because of the route of administration, it is called as the Uttara Basti. And next is, it is having the best property, or the effect is very good. Hence, it is called as the Uttara Basti. Types of the Uttara Basti are the Mutra Margagata Uttara Basti and the Yoni Margagata Uttara Basti. So, in Mutra Margagata Uttara Basti, in the Streeroga practice, the Mutra Margagata Uttara Basti is practiced if when the patient is usually complaining of the incontinence of the urine. So here they say about 20 to 30 ml of, or usually starting with the minimum dose of the 5 to 10 ml of the taila is administered through the Mutra Marga. So gradually we can go on increasing the amount of the taila which is administered through the Mutra Marga. So when we do this procedure, usually the patient will get good control over the urine. So if the incontinence is there, this Mutra Margagata Uttarabasti will be beneficial to the patient. Next is the Yoni Margagata Uttarabasti. So the route of administration is the vagina, through the vagina it is introduced into the uterus. So it is the intrauterine basti. So intrauterine uttarabasti. So here you can see that the basti is administered into the uterus. So Uttarabasti Yantra, as we know in the classics, we have got the Basti Putaka and the Basti Netra. So the classical one which we see. So this is the imaginary pictures which are given in the textbooks, how they were administering the Uttarabasti with the Putaka and the Basti Netra. So now in the current practice, how we administer. So these are the instruments which are used to administer the Uttarabasti. So here we have got the speculum and the retractor, and also so the speculum can be either the sim speculum or the cuspo speculum, and if the sim speculum is used, we have to use the anterior vaginal wall retractor and expose the uterus. So once the uterus is exposed with the uterus, in the sense the cervix is exposed, you have to hold the anterior lip of the cervix with the valsalum, and after the anterior lip is held with the valsalum, the length of the uterus has to be measured with the uterine sound. This is also called as the first dilator. This is also called as the first dilator, which helps in dilatation of the cervical canal. Next are the cervical dilators. So usually there is no need of the cervical dilators if the lady is already delivered. But in some of the nulliparous women, we may need the more dilatation of the cervix. Next, after once the cervix is dilated, now we have to introduce the medicament into the uterine cavity. So here usually what we are using is the infant feeding tube. So here you can see the infant feeding tube. So we take with the help of the syringe which is fixed to the infant feeding tube, we draw the dravya or the medicament. Either it is a sneha, usually it will be the sneha. We draw it and we introduce this dravya into the uterus. So indications of the Uttarabasti are in the classics. So these are the Yoni Vyapats, Yoni Shula, Rajodosha, Asradhara, Vandyatva, Gulma, Granthi, Arbuda. And also currently we can see the tubal block, premature ovarian failure, premature menopause. So these are some of the indications which are given for the Uttarabasti. So time of administration, it is told in the classics, it is the Artava Kala. So when we say Artava Kala, it is you preferably day 6 to 10, day 10 after the menstruation. This is because the cervix will be easily dilated, hence usually 6 to 10 days after the menstruation. And sometimes if the patient is in the reproductive period and there are chances of the fertilization which is taking place after the 10th day, which may be disturbed by giving the Uttarabasti. Hence, the best kala to administer the Uttarabasti is the 6 to 10 days after the menstruation. Coming to the pramana to be administered. So here, very huge quantity is told by all the acharyas. So it is 96 ml, Mutra Marga, Yoni Marga 192 ml. All this is told. But if it is the intrauterine Uttarabasti, if it is the intrauterine Uttarabasti wherein the medicaments has to be introduced into the uterus, the amount of medicaments which we take is usually 5 ml, and out of 5 ml we are not able to push all the 5 ml into the uterus because the capacity of the uterine cavity is very less. It may be somewhere around 1.5 ml to 2 ml. And even after giving 2 ml, once you give 2 ml of the dravya, push the dravya into the uterus, then also you continue pushing the dravya, you can see that the dravya will come out from the cervix. So the capacity is very less, and we take for the intrauterine Uttarabasti, the amount of dravya we take 5 ml, but only maximum 1.5 to 2 ml can be pushed into the uterine cavity. So here procedure, first of all the medicines and the instruments will be autoclaved, and the patient is advised to evacuate the bladder and the bowel, and the patient's vitals are checked, and Abhyanga and the Svedana of the Kati Pradesha, Udara and the Prashta and the Parshva Pradesha is done. Patient is put into the lithotomy position. Genital area is painted with antiseptic solution. Cervix, as already I have told, so the cervix will be visualized and the dilatation of the cervix will be done, and using the IUI cannula, the medicament will be pushed into the uterus. As I told, the amount will be about 1.5 to 2 ml. So here the dravya, the very small amount, but it should be pushed or injected very slowly into the uterine cavity. If it is pushed very fast, then the patient may go into the shock. That is why the dravya has to be pushed very slowly. This should be the precaution which should be taken while giving the Uttarabasti. So complications which can be anticipated during the Uttarabasti are the pain abdomen, then the infections, then the more severe one can be vasovagal attack. As I told, if the dravya is pushed very fast, then patient may go into the shock. There may be embolism, and there are chances of endometriosis. So here, why the chances of endometriosis is, endometriosis, as the name goes, implantation of the endometrium in the places other than the uterine cavity. So if there is any bit of endometrium which is retained in the uterine cavity, when the Uttarabasti dravya is being pushed into the uterus, the endometrium which is present in the cavity, it may enter into the tubes and it may get lodged there, and it may cause the endometriosis. Next, coming to the contraindications to the Uttarabasti are pelvic infections, endometriosis, and the tubercular infections. So, this is a brief introduction to the Sthanika Chikitsa. Now, to conclude, the Sthanika Chikitsa is the unique treatment modality of Ayurveda. So, these treatment modalities are economical. Next, coming to the scope for innovation in the treatment modalities. So, all these Sthanika Chikitsas has to be done in the hospital. The patient has to come to the hospital and she can either get admitted or some of the treatments apart from the Uttarabasti, all the other treatments can be done in the OPD basis. But still, the patient has to come to the hospital and get exposed. So it may cause inconvenience to some of the patients. So now we have the chance for the innovation. Just like I told you, we have made the capsules. So if the capsules can be given to the patient, she can administer the capsules herself. Similarly, any other modalities like we can make the tablets, or for the pichu, now the sponges are available, so something like that we can put the medicaments in the sponge, and it can be given to the patient. Some innovations can be thought of so that the Sthanika Chikitsa will be useful for the coming generation also in the new presentation. Okay, and also there is wide scope of research. So when I say the scope for research, actually the mode of action of all these Sthanika Chikitsas which are told, we have not understood completely. So we can try to understand the mode of action of all these, and also we can standardize these procedures. The procedures, all of the procedures which are told, when we see the practice of these procedures are varying from place to place. So we can try to standardize these procedures so that the effect will be very good, and it will be one and the same in all the places all over. Whoever practices these procedures, the effect will be one and the same. So with this, I conclude. Once again, I thank the organizers for giving me this opportunity.
Thank you so much, ma'am. Thank you. It was indeed a very wonderful session, ma'am. So, dear, but, ma'am, are you able to hear me?
Yeah.
Okay, ma'am. Thank you, ma'am. Thank you. So, dear participants, so this is a very brief and wonderful introduction session which has been conducted by ma'am. So, there are like much more to come. So, we have Sthanika Chikitsa in Streerogam, a course being conducted. So, whoever would love to participate in that, you will be able to enroll in the Ayurveda map. So there will be like a 4-day hands-on training in SDM Udupi also, which is a very beautiful. Will be going and hands-on training will be available. So thank you so much, ma'am. So moving on to the discussion session, I'll be requesting all the participants to either post their queries in the chat box, or you can unmute yourself and you can ask. Thank you. Ma'am, there is one question in the chat box by Dr. Hemlata. Namaste, madam. Treatment for Bartholian cyst. Ma'am, am I audible?
Yes. So treatment for the Bartholin cyst. As we
Yes.
see in the, am I audible now?
Yes, ma'am, you're audible, ma'am.
Yes. Okay. So treatment for the Bartholin cyst. If we have to speak from Sthanika Chikitsa point of view, I think the treatment for the Bartholin cyst is slightly difficult, because this comes under the purview of the Granthi, Arbuda, etc. Isn't it? So it is a cyst. So when there is a cyst, the treatment should be a Shastrakarma. So we have to go for the incision and the drainage. Okay, and sometimes what happens is there is recurrence of these cysts. Okay, so initially the patient has to go for the IND, and after, in spite of the IND. If there is a recurrence, then we may go for the Shamana Aushadas so that recurrence of the cyst will not be there. As such, we cannot treat the Bartholin cyst with the Sthanika Chikitsa.
Thank you, ma'am. Thank you for your explanation.
Yeah.
Anybody would like to ask any more queries? Ma'am, there is another question from Dr. Reshma. How we suspect cervical CA?
Pardon?
How we
How we-
suspect cervical CA?
Yeah, cervical CA. First of all, if it is very much initial stage, we have got the procedure which is called as the cervical screening. So with this, what we do is we go for the screening. We have got a certain test. Okay. So we apply the acetic acid to the cervix and we see if there is any color change. Okay. If the color changes to aceto white after applying the acetic acid, that means the patient has some lesion there. Okay. And if the lesion is there, directly we cannot conclude that it is a CA. It could be because of the infection also. So if the aceto white lesion is there, then next step what we do is we do a smear. We take a smear from there, and also we may advise a punch biopsy to the patient. That affected area, as I told you, aceto white patch. Okay, if the aceto white patch is there, you just take a piece from that exact patch and send it for the histopathological examination. Okay, so in this test, when we are doing the test, that is applying the acetic acid to the cervix, if there is no change in color, that is, if the color of the cervix is not changing, then we can say that the patient at that present moment, she is not having any cervical malignancy. But if there is a aceto white area, then definitely we have to take care. We have to take the further steps. Okay, we have to send her for the, if we can do in our setup, if all the facilities are available, then you can do a pap smear, and also you can do a punch biopsy, and depending upon the report, sometimes it may come as a malignancy or it may come as a inflammatory smear. If it is an inflammation, then treat for the infection, and if it is coming as the abnormal cells are seen, then you may have to proceed further for the investigation. So that is why routinely after the age of 30, the lady, it is better that the lady will undergo this test once in at least 3 years. Suppose once she has done this test, then there is no abnormality detected for 3 years, the test need not be repeated. But after 3 years, once again, she has to repeat this test. And also, next one more thing is we may have to see for the presence of the human papilloma virus. Okay, because if the lady is having, there is a presence of the HPV virus, then there is more chance of the cervical malignancy. Am I clear?
Thank you,
Am
ma'am.
I
Thank
clear?
you. Yes, ma'am.
Yes.
Yes. It was
Yes.
indeed a very nice explanation, ma'am. Ma'am, there's another query by Dr. Anjali. Namaste,
Uh-huh.
ma'am. Shamana Aushadhi for Bartholian cyst.
So, as I told, Shamana Aushadhi for Bartholian cyst is for the recurrence of to prevent the recurrence of the cyst. Okay. Usually, what I give, like you may give Kanchanara Gugulu, Kaishora Gugulu, Varunadi Kashaya, or any other like Gugulu Tiktaka Kashaya, Shiva Gutika, all these. If we give for say about 2-3 months or something, then usually the incidence, the repetition will be reduced. This is my observation.
Okay, ma'am. Thank you, ma'am. And there was another question like Sthanika Chikitsa and Shamana Aushadhi for endocervical polyp.
Endocervical polyp.
Yes,
So
yes, yes.
if there is a, once again, this is the anatomical defect, like, isn't it? Or pathology. So there is a growth. If there is a growth, usually the growth has to be excised. Shamana Aushadhi, with the Shamana Aushadhi, it is difficult to treat.
Okay, ma'am. Thank you, ma'am. And another last question. Good evening, ma'am. Sthanika Chikitsa and Shamana Aushadhi for uterine fibroid.
Uterine fibroid. Shamana Aushadhis, once again, now here, when we say uterine fibroid, okay, there are certain criterias, like one is the age of the patient, then the fibroid, location of the fibroid, and the complaints of the patient. Okay, so if the patient, the fibroid, if it is like the patient comes with the excessive bleeding, and if the patient is having dysmenorrhea, etc., usually the fibroid will be in the submucous area. So what we have to do is, uh, if the patient is, say, about, if she has completed her family and she is about 40 years or something like that, then just symptomatic treatments will be given. Like when for a dysmenorrhea you treat, and for excessive bleeding you treat. Even the symptomatic treatments will help you a lot. Okay, and for the Sthanika Chikitsa as such, for reducing the size of the fibroid is usually difficult. So in the fibroids, complaints we can handle well, but decreasing the size of the fibroid, usually it is difficult. So we can try, some people usually they try with the Uttarabasti. But as such, I have not tried with the Uttarabasti. In my personal experience, for the fibroids, I have not treated with any of the Sthanika Chikitsa to decrease the size of the fibroid.
Okay,
But
ma'am.
complaints as such, just with the Shodhana Chikitsa, we can treat the complaints, we can address these complaints very well. The bleeding can be controlled, pain can be controlled, but decreasing the size as such, very effectively, I have not seen. So if the patient is has completed the family, then you just treat her symptomatically. Okay. But if the fibroid is very large, she is not married or she is not having the children, she has to yet complete her family, or she has to just yet get pregnant. Size of the fibroid is large and it is in the submucous area or the intramural area. If it is more than 5 centimeters, better the myomectomy has to be done. Otherwise, there is no need of addressing these fibroids. If she is not having complaint and it is not disturbing, the size of the fibroid is small, say sometimes 2 centimeters, 3 centimeters fibroid will be there, it will be intramural, it is not giving rise to any complaints, then you can just neglect the fibroid. But if it is large, family is not completed, better go for a myomectomy if it is more than 5 centimeters.
Okay, ma'am. Thank you so much, ma'am. Thank you so much for your
Yeah,
information, ma'am. We'll be
yeah,
winding up the session, ma'am. Thank you so
yeah.
much, ma'am, for joining us and sharing your valuable information with us, ma'am. Thank you.
Thank
And
you.
thank you, participants, for your enthusiastic support and participation. See you all in the next session. Thank you. On behalf of Ayurveda MAP, thank you so much.